We are continuing our conversation today about that devastating incident that happened earlier this week with NFL player Damar Hamlin. People still praying for his recovery. Today we have a cardiologist in to tell us more about the differences between I'm thinking so much about the speculation and everything that we have heard. We are delighted to have Dr. Brandon Drafts in with us from Lexington Medical Center. Dr. Drafts, thank you for being here.
Happy to be here, thank you.
What did you think from a medical perspective when you first saw that hit?
Yeah, typically it's something we don't typically see on the football field. You know, when someone has a violent hit, we are automatically thinking head injury, head and neck injury, concussions. I think that's been kind of the reinforcing thing that we see, especially on football. But I was a little concerned when I saw him, how he fell. Because so he suffered the hit, he stood up for a second, and then kind of lifelessly fell down. And we see that a lot in cardiac patients, to where there's, you know, no sudden loss of circulation to the brain, to where they fall, and whether it be passing out, or in this instance it was cardiac arrest.
Yeah, and when it comes to cardiac arrest, I think that people may not really have a complete understanding of what exactly is happening to your heart in that moment. So explain to us exactly what cardiac arrest is.
So cardiac arrest in general is just a sudden loss of heart function. There's loss of circulation, and so there's no blood circulating to the end organs, the brain, the lungs, the kidneys, and the liver. And so that obviously can be life-threatening if quick action is not taken. There's many causes of cardiac arrest, and I think his cause is still unknown at this point. Generally, we see that with heart attacks, with lethal arrhythmias, whether it be ventricular fibrillation or ventricular tachycardia. Those can cause sudden stoppage of circulation and ultimately death.
You know, initially his uncle did an interview saying that he had to be revived twice, which created even more concern. Now the family says that he misspoke. And so can we read anything encouraging into that?
It's hard to say.
Okay.
It's hard to say. I think there's a lot of information that we just don't know. You know, for me, the initial event is very important. So recognition of that event, quick action, and so recognizing that he actually did not have a pulse and was in arrest, CPR, having an AED, defibrillating his heart to restart the circulation. So that's really important. I think where we are right now is just waiting for recovery, hoping that he has recovery of his brain function, that he has recovery of kidney or liver function if those were damaged. Again, we don't know. So a lot to be determined with that.
Yeah, definitely don't want to speculate, but when it comes to these types of instances, when you talk about recovery, how long does that look like? I know it could differ depending on that person.
Certain instances can be a very quick recovery, and so if it's recognized quickly, if action is taken quickly and it's reversed, you can have a quick recovery. And then other instances, we see a kind of a long, prolonged, drawn-out recovery where we're waiting for those end organs to recover, even if circulation is restored. And sometimes that can take days, and sometimes it ultimately doesn't. And so I think, in general, the longer you go from the initial event until you have recovery, I think the prognosis is more guarded and concerning.
And I certainly understand why the family and why his physicians are being guarded in the information they put out. I mean, you don't want speculation, you don't want to get ahead of the process, and there are no absolutes. This can, you know, these events are very different for each patient. But they did issue a statement today, the Bills organization, saying he was moving in the right direction. There's nothing medical, you know, in that description, but what could moving in the right direction look like?
That could mean a lot of different things. So it could mean that his end organs are improving. We check a lot of different tests and blood work to see if his kidneys are getting better, if his liver is getting better. We can assess how much support is he on. You know, ultimately you want him to be independent of any type of support, whether that be with ventilation, with a breathing machine, or any type of circulatory support with medicines that we use for blood pressure and things like that. So the less support that he is on is better. And so the quicker that he can become dependent on sustaining that function, the better.
Damar, 24 years old, a lot of people are saying, how could this happen to someone so young? Does age play a factor in this event?
In general, for cardiac arrest, I think so. I think the older we are, the more risk we are to have heart attacks and have these other things that can cause cardiac arrest. I think his instance is extremely rare. And so again, unknown what caused it. I know a lot has been out there about a condition called commotio cordis, where you have blunt force, a perfect storm of events of blunt force to the chest wall that causes you to go in ventricular fibrillation, which is a lethal arrhythmia that causes the arrest. And so that's what was ultimately recognized, and they had to shock his heart. So that's definitely a theory that makes sense, but still unknown.
Well, I think it's worth reiterating what you just said. Very rare event.
Right.
And obviously getting a lot of attention because it happened live on national television. But it is a great opportunity to educate people about these heart conditions and about preventative measures that we all can take to be more aware of our health. And we want to focus on that when we come back, especially as it relates to kids, because a lot of parents are really worried about, they're like, my kid's not playing flag football, any kind of tackle football or anything like that. We'll talk about how to help make an informed decision, not based on fear, but just based on facts, so that you know what you're dealing with when it comes to your kids and making that evaluation. We'll have more with Dr. Brandon Drafts from Lexington Medical Center right after this.